perder mucho tiempo, y mi tiempo es muy valioso.
The atmosphere is festive, the crowd diverse in the so-called Global Village outside the 17th International AIDS Conference in Mexico City. In the tents here, people from around the world can mingle and they can share informally their organization's separate approaches to the treatment and prevention of the incurable disease. Most of the serious work happens in formal sessions. Here researchers present their papers and high-profile speakers rally advocates to the cause of combating AIDS. Former U.S. President Bill Clinton was one of the more popular speakers this year. He heads a foundation that seeks to lower the cost of AIDS medication. Clinton said the dedication of those fighting AIDS is making a difference.
We cannot let setbacks in the research agenda obscure the progress made, the money committed, the incredible broad coalition of people determined to act with the same urgency of a mother rushing to get medicines to save a dying child.
Back in the Global Village, sex workers are among the most unconventional participants. They argue that their work should be legalized as a way of improving public health efforts to combat HIV infection. Rachel is a sex worker from Australia.
Sex workers are part of the solution, we're not the problem. If people are really serious about combating HIV and to increase the levels of education and adherence to safe sex practices, sex workers need to be included at all levels.
AIDS experts say the condom is one of the most important tools in preventing transmission. And condoms are widely distributed here.
How much is a balloon anyway?
There's even a cartoon that features comic condom characters by a group from Canada, represented here by Caitlin Delaney.
Until there's a cure, prevention is the only way to deal with not getting AIDS. And also, too, it's important that when you are infected, that you still work with prevention, and the best way to do that is with a condom.
You count down from 100.
Condoms do not provide 100% protection, but public health expert Jose Jados Conmenge says they are an important prevention tool.
A condom can break, or people are not using condoms properly, but if you use them correctly and use it all the time, obviously you are well protected against AIDS or all other sexually transmitted diseases.
In more conservative societies, it may be difficult to speak openly about such topics as sex work, condoms, and sexually transmitted diseases. But health professionals attending the conference say dealing with the threat of HIV/AIDS openly and honestly can save lives. Greg Flakus, VOA News, Mexico City.